Allison for Windsor Regional Hospital. Earlier this year, there was concern that a patient at the Niagara Health System might be infected with the Ebola virus, but the hospital's chief of staff said his hospital was prepared. In a news release, he said, "We have a brand new facility with negative pressure rooms and isolation abilities." He was talking about this 375-bed, state-of-the-art new hospital. Much like the new Windsor Hospital project, the new St. Catharines site replaced two outdated community hospitals.
I'm standing in front of the history of St. Catharines. The St. Catharines site that we moved from was 100 and some years old. There were parts of the building that were built in 1848. And so it was a big transition to come from that history to this beautiful, high-tech, very innovative design.
The modern facility is setting a new standard for infection control. I'm standing here with Shelley Schmidt. She's the manager of infection and control at the Niagara Health System. And you said this has changed your job. Tell me how.
It's changed my job immensely in that all the processes were established into the design and the build of this new facility, so we don't have the challenges that we're presented with the old infrastructure at the older buildings.
And in one word?
In one word, it's easier.
There are 1,400 sinks and hand washing stations here. 80% of the rooms have only one bed. Every unit has at least one isolation room. And in the event of a pandemic, the ventilation system here can split itself in two to create two distinct air handling zones and prevent the spread of contaminated air.
What that allows us to do is to be able to separate the front end of the hospital and continue to provide ambulatory care if there's an outbreak and we need to isolate the back end of the hospital for infectious diseases. If you think back to SARS in 10 years ago, one of the issues that arose then is that hospitals were basically closed and they could look after inpatients, but they couldn't or they weren't able to look after ambulatory care patients. In this organization, you can actually isolate the two.
The patient that sparked the concern earlier this year did not have Ebola. But Niagara Health System is ready for the worst, with a modern facility that's much more advanced than the one these guys built many decades ago.
I think they would be very proud of the work that we've done to advance infection prevention and control and to make it a patient-family experience.